Hi, my name is Janelle White and today I'm joined by Patsy Yates and Karen Clifton. This presentation will describe to you our 3 national programs funded by the Australian Government Department of Health and Aged Care and how we work synergistically together to improve palliative care in residential aged care nationally. To those working in aged care, it comes as no surprise that death and care of the dying are part of routine care in aged care homes across Australia. It took a Royal Commission into aged care quality and safety to get the attention of the nation. The Royal Commission highlighted the need for early identification of deterioration and the need to commence palliative care sooner rather than in the last days of life, as we know that palliative care is essentially about improving a person's quality of life as they approach death. The Royal Commission also highlighted the need to improve palliative care in aged care overall, which includes a robust system to measure that improvement. Our 3 programs can do just that, improve palliative care in aged care. 2 of these programs are well established, and that is ELDAC and PEPA. And PACOP is the new kid on the block and has come about specifically to address some of the findings in the recent Royal Commission. Together, our 3 programs work synergistically to help staff in aged care to learn, practice and do optimal palliative care. Together, we can contribute to residents in aged care experiencing a good death.
Hello, my name is Karen Clifton and I am the National Project Manager for ELDAC, or End of Life Directions for Aged Care. ELDAC is a project funded by the Australian Government Department of Health and Aged Care to support quality care for aged care recipients at the end of life. The project is led by a consortium of 3 universities and 4 peak bodies representing aged care, primary care and palliative care organisations. ELDAC has 4 major objectives: providing specialist palliative care and advanced care planning advice to aged care providers and GPs, improving linkages between aged care services and palliative care services, improving the palliative care skills and advanced care planning expertise of aged care service staff and GPs, and with an overall aim of improving the quality of care for aged care recipients, preventing unnecessary hospital admissions and shortening hospital stays. ELDAC has 5 work streams. It is quite an extensive project and I encourage you to visit our website for more information, but I will provide you with some highlights here today. The first work stream, Information and Advisory Service, incorporates a web-based hub for palliative care and advanced care planning information, tools and resources to inform the work of aged care and primary care providers. The website includes several toolkits, including residential aged care and end-of-life law. The Residential Aged Care Toolkit is structured around the ELDAC care model. This model is a guide to help aged care staff meet the needs of older Australians coming to the end of their life. It reflects national policies and practices in palliative care. The toolkit has information and resources relating to the elements of the ELDAC care model, and it can help you determine whether a person is approaching the end of their life, how to plan and deliver care for a person, how a person's care needs might change over time, what resources would be useful for you in providing care, and whether you have education or learning needs. Workstream 2, Technology Solutions, has developed several initiatives, including a digital dashboard, an online self-care resource, and a care worker app. The Self-Care Room is now available on the ELDAC website. It offers a smorgasbord of information, downloadable resources, printable posters, and online activities, including developing a self-care plan. Resource links are organised by topic, from which users can select depending on their time, needs and preferences. Workstream 3, Workforce Capability, is a new workstream for Phase 2 of ELDAC. Priorities include the development of a database of education activities relevant to the aged care workforce, learning pathways to guide health and aged care providers to relevant learning resources, and education and training activities designed to address identified gaps. Workstream 4 is service partnerships. Linkages facilitators work with aged care services in partnering with specialist palliative care services, primary care, PHNs, and other service providers to enhance palliative care and advanced care planning outcomes. This includes referrals to other national and state-based projects such as PEPA and PACOP. The ELDAC facilitators also conduct extensive needs assessment with aged care services to identify gaps and priorities, navigate services to appropriate resources, and provide advice on organisational strategies to enhance their palliative care practices. Our final work stream is system capability. One aspect of this work stream is the My Care Matters national campaign. This campaign is designed to improve deaf literacy and awareness in the aged care sector. Aged care workers are encouraged to get involved by spreading the word, signing up for campaign alerts, or becoming a campaign champion. Thank you very much for your time.
Hello, I'm going to talk to you about the Program of Experience in the Palliative Approach Aged Care, or PEPA Aged Care. PEPA Aged Care is a program funded by the Australian Government Department of Health that really focuses on improving the knowledge and skills of the aged care workforce in providing palliative care. PEPA itself builds on an existing program that's been around for a number of years. And its main aim is to take an experiential, active learning approach to ensure that we get the best learning outcomes. Specifically, it's focused on improving the knowledge, skill and competence of the aged care workforce in delivering a palliative approach. But more than that, the approach that we take within PEPA is not just about providing knowledge and lectures. We do have a series of workshops, but it is actually about trying to provide an immersive experience. Typically, that experience is taking a healthcare worker or an aged care worker and enabling them to spend some time with the palliative care service. But in the context of PEPA Aged Care, we've reversed that. We're using what we call a reverse PEPA model, where we have a number of educators who go and spend time in a facility to build that knowledge, skills, and also work at the organisational level to help ensure that that knowledge and skills is sustainable and supported at that organisational level. So second objective then is, in addition to knowledge and skills building, we're really focused on enhancing and building networks between specialist palliative care providers and the aged care workforce. It is delivered by by some of our nurse educators. We have about 5 nurse educators who work across the country, who will go in and spend some time in an aged care facility, undertaking learning assessments, looking at what the priorities are for education, tailoring a series of educational activities, and then providing ongoing support to continue to mentor, link them in with communities of practice so that we can continue to build and improve that knowledge and skills over time. So PEPA Aged Care, it actually provides individualised learning experiences, particularly for the non-specialist health and aged care workers across all areas of Australia, rural, remote, metropolitan settings, in what we call this reverse PEPA model, where our educators go in, spend some time in an organisation. It's about building linkages between specialists and aged care service providers. One of the issues we address is, what's your network around you? Who can you refer to, whether it be in primary care, whether it be in specialist palliative care, so that the aged care providers feel supported in their delivery of palliative care and able to draw on a team. And it is about providing mentoring and resources, both in collaboration with ELDAC and PACOP, so that we're all working together to support the overall quality of end-of-life care. And here's just an example of some of the resources we have. So we have learning guides for nurses, for GPs, for aged care workers. We've got a whole series of learning guides that really cover the basics of palliative care and provide lots of links and resources. We have other guidelines, and here's an example of a quick guide to the first conversation about palliative care, for example. And it's really particularly tailored for knowing that the generalist workforce has not always had training, and this provides some sort of starters and some beginning so that you feel more confident to be able to deliver palliative care. We also have what we call IPEPA, and IPEPA is really our tailored resources and education focused on Indigenous healthcare workers, and also for non-Indigenous healthcare workers to build their knowledge and skills in providing palliative care to our Aboriginal and Torres Strait Islander population. And our IPEPA, as we call it, has got a particularly tailored program driven and led by some Indigenous health workers that really is meeting a huge need in terms of providing culturally safe palliative care. So thank you for the opportunity to share our ELDAC, our PEPA aged care project with you. Thank you.
Thanks so much to ELDAC and PEPA for that great overview of your fantastic programs and all the work you do. My name is Janelle White. I am the National Quality and Education Manager for PACOP. PACOP is the Palliative Aged Care Outcomes Program. And after the Royal Commission into Aged Care, we received funding from the Australian Government Department of Health and Aged Care. And our vision is to support aged care homes to provide optimal palliative and end-of-life care to residents and their families through embedding a standardised clinical assessment and response framework. Then, through measuring and reporting of the outcomes from care, we can facilitate continuous quality improvement in aged care homes and the wider aged care sector nationally. In keeping with the theme of today's talk, PACOP supports aged care homes to learn, practice and do optimal palliative care. How do we do that? We help aged care homes embed a framework of standardised, evidence-based clinical assessment tools and processes. This framework helps aged care homes identify when deterioration is happening and when palliative care needs are increasing. We do this through two collections, the Profile Collection and the Outcomes Collection. The Profile Collection standardises the routine 3-monthly assessment that generally occurs in aged care homes, like Resident of the Day. It also helps identify deterioration and increasing palliative care needs in residents. If they are identified as needing palliative care, residents then move into the Outcomes Collection. The Outcomes Collection is evidence-based palliative care assessment, and it provides a clinical response protocol to ensure optimal outcomes from care. PACOP also provides all initial and ongoing education, including resources and workshops, to participating aged care homes. This empowers and also upskills the aged care workforce. PACOP also provides ongoing support to homes, from implementation to embedding and sustaining the program for the long term. We help aged care homes do continuous quality improvement, and we have PACOP improvement facilitators who help homes do that. And we work with aged care homes in an ongoing basis through our community of practice model. PACOP also provides outcomes reports based on clinical care every 6 months. This helps aged care homes practice continuous quality improvement in their home, but it will also help us look at quality improvement across the wider aged care sector. Our program is free to anyone who wishes to participate. PACOP is helping aged care staff to learn optimal palliative care, and we do this in a variety of ways. Mostly it's through building really strong partnerships and collaborating with key people. And those key people are the PACOP champions or PACOP leads in the individual aged care homes. But also we work with external education partners as well. We provide ongoing support to both external and internal education partners through our community of practice model, as mentioned previously. The PACOP improvement facilitators educate internal and external partners and provide ongoing support to the PACOP champions and PACOP leads in aged care homes. PACOP is proud to say that we work with and refer to ELDAC and PEPA, where our three programs overlap in the residential aged care space. All of PACOP education resources have been standardised and they are available free online, and also we have a range of physical resources to support the delivery of our program and to support optimal assessment for palliative aged care. PACOP also has a YouTube channel, and if you go to our website you can be directed there, but it provides a wide range of video recordings of our lectures and information about how to embed our program and use our clinical assessment tools. Finally, using the PACOP framework with its tools and process, PACOP helps staff in aged care to practice and do optimal palliative care. Before you, you can see a selection of some of our evidence-based clinical assessment tools. These help staff to practice and do palliative care in a standardised way. We also provide aged care homes with an assess, respond, plan protocol and a framework for time points to gather assessments. The assess, respond, plan protocol also helps staff to know what to do with the scores once they've assessed residents. So this provides a really nice framework for staff to practice and do optimal palliative care for their residents and families. Hopefully, after hearing a snapshot of our 3 programs, you're starting to see the synergy between them. All are free and keep the resident at the centre of what we do. Our programs work independently, but also work really well together in an aged care home. Support is ongoing to aged care homes as they are involved in our programs. We share referrals with each other, and in fact we encourage them and they are supported between us. The staff in all 3 of our programs collaborate in a community of practice to ensure all of our work is complementary and there's no crossover. We work together to improve palliative care and aged care by providing education to help people learn optimal palliative care, to upskill staff in palliative care practice, and we also work together for the provision of optimal palliative care tools and processes to embed the doing of palliative care. Thank you for your time. For more information on any of our programs, please scan the QR code that will take you to our website. Thank you.